Chapter 4, Integumentary System. In part 2 of the chapter, we're going to look at definition, pronunciation, and spelling of surgical and complementary terms. We're also going to interpret the meaning of abbreviations and apply the language to in a medical aspect, such as in a case study. Two examples of surgical terms built from word part, and that includes dermatoplasty, which plasty means surgical repair, and dermato means skin, so this is surgical repair of the skin. We also have retidectomy, and ectomy means an excision of, and retid meant wrinkles, so this is an excision of wrinkles, and we know that very loosely termed or called a facelift. And examples of surgical terms that are not built from word parts. And again, this is where you have to find a way that works for you, really, to memorize them. There's no way of shortcutting it or taking it apart and learning it specifically from just breaking down the terms. You may sometimes see that it will contain a word part, but it will not be fully able to define the term based on the whole word. So we have cauterization in this section. That is destruction of tissue with either a hot or cold instrument. It might be from electrical current or something caustic that basically destroys that particular tissue area. We also see cryosurgery, and that is, again, removal or destruction of tissue. And usually this one is from the cold. Cryo refers to cold, and this is usually with the use of a liquid nitrogen most commonly. There's also instrumentation that does that as well. But excision is this removal of by cutting, and Mohs surgery is a procedure where they remove a tumor, trying to preserve as much normal tissue as they can, and while they're doing the procedure, they'll also look at the specimen or at the procedure and look to whether or not they have fully gotten all the edges of that area. Skin graft. This is basically a skin transplant. For whatever reason, they're replacing tissue that maybe has died away or has been injured, and they can't reattach it and those kind of things. And it can be any level of depthness of the skin, so it can be very shallow or very deep, either one. The next is complementary word terms built from word parts. First one is erythroderma. Derma means skin, and erythro means red, so this is red skin, and usually you're talking about something that is unusual, not a normal coloring. Hypodermic, the dermic means this is pertaining to the skin. Hypo tells us it's below or under, so this is pertaining to under the skin. Percutaneous, OUS would be pertaining to, and then per is through, cutano is skin, so this is pertaining to through the skin. Subungual, and ungual means pertaining to the nail. Sub means under, so this is pertaining to under the nail. And then the last one is xerosis, and this would be abnormal condition of dry. Some terms that are not built by word parts include abscess, which is a localized collection of substances, really. It could be pus, bacteria, and kind of a mixed bag. And it will appear somewhat like a lump, but it's inflamed and irritated, and it can be inside the body or it can be on the outside of the body somewhere. They're not real uncommon, really. Diaphoresis means sweating. A macule is a flat colored spot on the skin, and basically we loosely call those freckles. Papule is a small solid elevation of tissue, and that we see that sometimes in things like a skin tag or in a basal cell carcinoma, maybe look like a little lump area. A vesicle is has a small elevation, and it contains fluid, and this is what we would generally call a blister. Get some abbreviations, and there's actually several in this chapter, so be sure to review them all. The first one is FTSG, and that means full thickness skin graft. IND means incision and drainage. SLE is systemic lupus erythematosus, and TD means transdermal. In this part, we're going to review a clinical note, and of course, those that are bolded print are the terms that are predominantly from this particular chapter, so you especially want to note those. And it would be a good idea to actually write those down and define them out as well. Emily visited the dermatology clinic because of pruritus, secondary to dermatitis, involving her scalp and areas of her elbows and knees. A diagnosis of psoriasis was made. Eczema, scabies, and tinea were considered in the differential diagnosis. An emollient cream was prescribed. In addition, the patient showed the dermatologist the tender, discolored, thickened nail of her right great toe. Emily learned she had onychomycosis, for which she was given an additional prescription for an oral antifungal drug.